Hello, good evening, students. Uh, this is Dr. Hemanth, Faculty of Medical Oncology at DocTutorials, and along with Ms. Dr. Vijay and Kiran. It's been some time that I've been a part of a live session, and I'm here today excited because it's just 4 weeks away. The most important exam for this academic year. But always quite a few questions that are asked in the group, and few questions ask me exactly how probably to go about. And that is what I'm going to discuss. And I have taken Dr. Rahul Rajiv and Dr. Karthik's input as well because they've been the guiding mentors for all the team here. So the biggest question is people ask me, is 4 weeks enough? Is it enough? And I'll tell you that 4 weeks can make the difference. Trust me, when I gave my first exam, that was for the AIMS December, that was 2015, I remember. I was close and I hardly had just probably 4 to 6 weeks to kind of make an attempt. But I realized that probably, yes, if I put more effort, it would be better. And which I think all of you have already done, knowing that the exam was due ideally last month, and probably you were quite ready. But then this is the last push that you can get. So, what to do in this 4 weeks is what is important. The most important question that I would suggest, most important suggestion from my point is don't try to really read up new stuff, especially new resources. Try and reading a new book and start making notes from that. No, you're going to waste time. So, more importantly, what I would feel is you should revise. Revise whatever you have done, your notes, your charts, the images, the algorithm, diagnostics, anything of that sort, revise. And every time you revise, you just don't brush it up. Okay. Your first few revisions should be deep. Think and rethink what else can be asked on the same set of topics. And then you keep repeating it. What happens this way is your memory is sound now. You have image imprinted in your brain. And probably any question related to that, probably you're going to do well. Now, we always try to see what has been the past scenario, okay, past NEET SS exams, and then see. Many of the times what has happened is it has kind of overlapped with the aims. And this times I felt that the aims paper was much more sensible. Okay. It was clinical, practical, guidelines, nearly straightforward. Try to assess your knowledge on the most important aspects. Okay. And it was pretty much workable. Okay. Now, the last NEET SS was not the same. It had quite a few issues, and especially I felt the paper was more AI generated, where you had really weird topics at times or repeated topics, multiple questions. So it was quite probably an outlier compared to the previous exams, but this is how it has previously very well looked. And more importantly, 4 weeks is not the time to learn new things, but to revise smartly. And those are the ones who are going to do well. Okay. So on the resources that we have got videos, we've got a latest discussion, Harrison 22nd update, QRP, QBank, and grant test. More importantly, if you see the last 1.5 months, Dr. Vijay and Kiran and me, wherever possible, have been trying to be really active in the WhatsApp group discussions. And based on the recent AIMS questions, you realize that quite a few of them had been discussed in the group. So keep focusing on the WhatsApp group discussions and update as well. We might be posting some important algorithm that you need to remember. So stick to those, and probably whatever you have from this, try to revise and probably rethink and repeat. So for the NEET SS, most important, like I told you, revise from your notes. Solve MCQs every day. Now, whenever you solve MCQ, it is not just answering the question and to assess if it's right or wrong, but more importantly, learn how to crack the question when you may not know everything about it. So this is what is important because students have been messaging me that So you've got around 100 right, then you've got few unattempted and few wrong. Over time, what exactly should happen? Your answers that you have answered right should go up with every grant test. The wrong probably may take time, but unanswered probably should reduce. Okay, the unanswered ones are to be the right, or the ones who are just supposed to be wrong to the right. And hence, going ahead, the least proportion should be the ones that you have answered wrong, the ones you have not attempted the next, and then the best should be what you have answered the most. Okay. So this proportion should kind of vary and improve with every other test. Okay, that is how you should aim at. So in case things are not going right, look at the questions which have kind of really not unattempted. Take a look again and see, would you have been able to attempt this question if you kind of tried to think smart? So most of the time you may not know everything about that topic, but especially if this aims, if you see plenty of questions, you could kind of really eliminate two questions and think about, or definitely there were clues quite enough in the question itself where you would be able to answer. So try and do that. Look at the explanations. Make sure you read the explanations well, because there's plenty given in the explanation where you may be able to kind of come up with new questions and you'll be able to answer well. Question paper would have been set by now, so less likely to have included the really latest updates which are happening in this month or probably just the last month. So less likely, not that it can't, but it is less likely. More importantly, keep a track of the time whenever you solve. Okay, whenever you solve an MCQ, think of the way how you're going to give in the exam and solve accordingly. And more importantly, focus on treatment and diagnostic algorithms. These have been kind of really multiple time asked. So questions like febrile neutropenia, SVCO, uh, hypercalcemia, the causes, everything. So you have this treatment diagnostic algorithms and high yield tables which have been asked repeatedly. Vijay, any inputs at this point of time? Just go ahead. The other more important point that we had a discussion with Rahul sir, and also probably what he has mentioned in his video also, maintain an error logbook. I think there are plenty of times that we end up making a mistake. We try to think why we made a mistake, but probably might not really go inside that. Maintain an error logbook, the questions that you missed or topics that basically may need a relook, so that you don't miss out on those cases or questions. So maintain an error logbook, try to find out what went wrong with those particular questions and what probably are important takeaway points with that MCQs. Going ahead, as the time kind of is moving towards the exam, do more grand tests, because this will give you more real scenario setting. Don't do multiple grand tests on the same day, but instead kind of focus on that day. Your main aim is to be do the grand test and analyze how things are going to be. So keep a track of the time, make sure you're really away from any other distractions, keep a track, and the real scenario settings, what probably, how many you're going to attempt, how many is missed and how many is probably wrong. Try to focus on that part and improve on that. Have a timetable. The timetable is not basically to read new stuff, but to revise and repeat. And I am a big fan of this Pomodoro technique, which I have used personally in my time. What probably I would do is read for 25 minutes, take a 5-minute break. In that 5-minute break, just kind of close your eyes, just try to revise what happened in the last 25 minutes. You do that for 2 hours, take a 15-minute break, just walk around, get out of that room or place that you're sitting. Don't sit there and just relax. Take a walk, just go out, breathe some fresh air, and at that point of time, try to revise what happened in those 4-5 minute breaks that you have taken. Try to think what probably you thought about. With another 120 minutes gone, that is total of 240 minutes. So that's another 15-minute break. And once that is done, now you have kind of spent a good number of time, that is probably around 4 hours or so. In that 30 minutes, just go by your notes, flip the pages and kind of revise what you have done. And after that, take a nap. Okay. This nap is usually just a power nap of 15 minutes. You close your eyes and kind of you try to kind of uh, really dissociate with what you've done. I usually try to just focus on my breathing, try to kind of really calm it down, slow it down and see. And within that 15 minutes, it's like you've slept for a few hours. Okay, this I do on everyday basis even now. So even after a busy OPD, I just need that one nap. So every 4 hours, try to kind of see this nap. This nap should not be few hours. It should be just 10 minutes, but it should feel like few hours. Okay. So keep doing this, and uh, that is what probably is going to help. So once you start doing this on a daily routine, the next one is should be at the end of one day is what you're kind of in the evening. First, just 1.5 hours is probably just to revise what you've gone through in the morning and probably check on that error logbook and or see what are the important topics. After 3 days, revise on what probably you have uh, gone through in the last 3 days, and probably at the end of the week, just focus on what probably went by the week. So by 3 weeks time, you should be done with this. And the last week is just kind of focusing on the most important topics and then do. More importantly, good sleep is important. I never realized I was somebody who would hardly sleep. Vijay and Kiran both know that I would probably, even if I have a presentation, the presentation would get ready at 7:45 in the morning when the presentation is to be 8. Would sit throughout the night and keep doing it. But I only time I realized my productivity was the best was the only time I slept before my one exam. I had never ever slept before any of my previous exam, but the only exam that I had slept for around 5 to 6 hours was my DM practical exam, and trust me, that was my best examination ever. So after that, at least in the current setting, whatever, I try to kind of get a good sleep and use it, and that is something is going to help. Sleep deprivation is not going to help. You need to get at least minimum of 5 to 6 hours of continuous sleep. Eating is important. Eating on a regular intervals, hypoglycemia, anxiety is something that keeps coming. Exercise is something that probably I used to do. The one thing that I used to do, which I probably learned from a TV series called Elementary, where Lucilio, how she kind of plays and tells what helps her thinking, is doing a squat with the open hand and close hand. Okay, probably if can somebody check on the elementary video, you will probably get it. And that really helps because it pumps the blood in the calf. You just kind of, it's a very quick cardio for 5 minutes. It really helps. So that is something that has helped me. In case something helps you, do that. But focus on these three aspects also because your mental health is important while the same. So it is not only how you're kind of preparing for the exam, you're basically ensuring that things go well on that day. So that part should start from now. Don't keep it for the last. More importantly, what not to do. Don't start afresh with new resources. Definitely, in case there are people who are trying to sit and go through the entire Harrison 22nd edition now, trying to see what new has come. No, probably you would have already read this in other classes, videos, etc. Because it has been updated quite some time back. So don't start with new resources. Don't start sitting with NCCN guidelines now. Maybe the most important is, but definitely not everything. Don't keep doing the same thing again. So on one day, don't just keep doing MCQs from morning till night. Keep the variation on revised notes, MCQ, images, algorithm, grant tests, okay? Something of that sort. But don't keep doing the same thing and don't make it monotonous. And one important topic point that I would want to tell, don't get distracted by discussion at times. In the WhatsApp discussion, sometimes even I feel probably things are going way above what is probably needed. But whenever a student asks, we try to guide them on what probably the answer would be. Just because, say, some discussion is going at a very high level, it may not be something that is maybe relevant to the exam. Ignore it if you don't understand. That is what you're supposed to do now. Okay. So don't get panicked by, oh, this is something that has been discussing and I have absolutely no clue about it, it might not be really relevant. Okay. So don't get distracted by the discussions that sometimes happen in the WhatsApp group. We try to kind of maintain a composed atmosphere there. But yes, at times when students do ask, it just goes out of hand on we end up going into too much depth. More importantly, like how I told you, don't look at the competition, don't look at people around. Focus on what you want. Okay. Focus on what you should kind of achieve with your preparation that is there. Plenty of seats there, all the places are good. At the end of it, this is an exam to get a place so that you get your degree over the next 3 years. What matters is once you come out of that. So don't look how probably the ranks may look or the results may come out. Yes, we would want the best from you, and that is what we want from ourselves also. But don't over pressurize on that. So don't look at the competition around, focus on what you want. Okay. High yield topics are extremely important. The same old thing, common things are asked commonly and not to be missed. There are high yield, there are some volatile topics, some rank deciding contents. I think AI has been something which has been on the recent times, and I had shared the LEK paper and other papers. ESMO has come up with the AI and molecular guideline, which probably I'll share in the group. So go through the at least the basics of it, and these questions many a times you will be able to kind of eliminate two options and go involved. Algorithms, images, again, the most important things, what I call is a dream revision. This is what I used to do. Algorithm images, I had a separate category in my phone. I would download the images and keep. Okay. So at the end of the day, when the day is over and probably you have had your dinner, you're going to sleep. We have a habit of scrolling through Instagram. Don't scroll through the Instagram or other social media. Instead, just scroll through these images. Okay. So when you keep doing that, what happens is, I still remember for my DA exam, I used to have around 150, 170 images collected over the 4 weeks or so. The initial 1 week, 2 week, it would take me around 1 hour to kind of really understand what I'm looking at and what probably questions could be asked based on that. But towards the end of it, the entire 150 would probably get over within 5 minutes. Okay. So store images on, say, Cairo Bishop criteria, SVCO management, what is what. Okay. IHC, carcinoma unknown primary, the algorithm images of that. Keep checking on a daily basis. Do it consistently. Okay. These are most important topic for your exam, for your future. Okay. So you keep doing that. At the end of it, what happens is in your dream also, you will end up having a recap of the same. Okay. Yes, you should be kind of not focusing and seeing this in a dream also, but that is something that helped me and that's what I'm sharing. Definitely past exam repeats, don't ignore. Plenty of repeats, usually at least 10 to 15 questions have been repeated every time. So definitely don't ignore. And probably looking at what are the most high yield topics that have been asked. This is 2020, uh, uh, the last paper that had happened. So if you see, the most important topics include SVCO, okay, vascular access device and complications related to that, tumor lysis, oncological emergencies, very important topics like GTN, multiple myeloma. Okay, cancer thrombosis is a favorite topic of that has been asked. Febrile neutropenia is something again important. AI in oncology, chemotherapy toxicities are important. So if you see that a good number of questions, at least probably 30, 40 questions are from these. And this is something that you should not kind of definitely miss. And these have been covered extensively in the past. Okay. So one of question was doxorubicin cardiotoxicity, nearly 6 questions. So that is what I told. The last paper seemed like it was AI generated because you ask the AI to generate question on SVCO, it will give you 15, 20 questions, you choose 6 out of that. That is how it looked like. But definitely these are important topics not to be missed. Okay. And febrile neutropenia, AI in oncology, multiple myeloma, and diagnostics, what are high risk, this thing. So these are set standard tables. These are not to be missed. These are just giveaway questions in the exam. the question is there, there is kind of really no major thinking to be done. Okay. And the answering is usually easy. So Corona score has been asked multiple times. Okay. Almost every other time. So you need kind of just imagine if you have not heard about Corona score before the exam, that is definitely not acceptable. Okay. So you need to be really thorough with what is asked in the past. So if you look at NEET SS 24, chemotherapy toxicity, there were almost 19 questions. Okay, that included something like oxaliplatin toxicity, cisplatin, anthracycline toxicity. Not anything new drug, no major new drugs. Okay, the same good old drugs have been asked again. Oncological emergencies are asked again and again. Pain management and palliative care is again an important topic. Vascular access catheters, heme malignancies are something very common. Febrile neutropenia, targeted therapy, and AN oncology. So if you look at this table, I think if you see, probably we have reached around 60 odd questions, right? So at least 60 odd questions with just this topic. So that comes nearly around 50% of the topic. So it is important that this is something that you should definitely not miss. Uh, these questions, again, these oncological emergencies, these are straightforward. There's no new update coming. Okay. So this has been what is there in Harrison, what is probably there in any of the guidelines. So things have really not changed much. So absolutely no blunder to be done in these questions. And the questions come and then 5-10 seconds you need to answer it. You are going to gain time for your rest of the things. So make sure that you are thorough with these topics and not to miss it all. So TLS diagnostic criteria, the timing of the criteria, what causes, why do you use Raspberry case? Okay, SVCO management, the classification, cardiotoxicity of doxorubicin, vascular access peak devices, hematological malignancies, cancer cachexia. So these have been asked again and again and not to be missed at all. So it will be a blunder in case you have not gone through the previous year questions, not gone through the high topics, and you are basically just going out for the war there, right? So definitely not miss on that. So to summarize, I think this was not going to be a long session, but something that you have been doing, just requesting you and letting you know that what you've been probably doing is right. So revise. It is more important than any new content. Try not to read really new molecules. Uh, Hardly any questions have been asked about really new molecules. If you see the aims also, probably you won't get really new molecule, new approvals. Don't go through the trials, clinical trial and outcomes majorly. Yes, few questions can come, but that is not what you need. You need to, in the exam, what you need to do is score what probably everyone is scoring and then add it something to that. If you're missing out on really so that you should be answering and then trying to analyze and try and answer what is really new content, probably that's not the way to go, right? So focus on the quality than the quantity in the recent times. Focus every day on how probably you're going to give exam on that day and how probably you're going to prepare. That is how you should start now. And consistency is more important than the burst. It should not happen then you are reading 3-4 days continuously and just next 2 days you are out of form. You're just not able to focus. At this time, your aim should be focus and being consistently, even let it be just probably 10 hours a day, 12 hours a day. I probably could not sit for too long. Okay. So focus on quality, consistency, and revising, and focus on yourself. Don't look at others. You may have a small group. So when I was preparing, I had 2, 3 colleagues where we would keep sharing these images and kind of try to recollect, remember. It might be worthwhile doing that because you will end up missing something. So you have a small group of 3, 4 people, your very close colleagues who are there, who are preparing with you. Share content, discuss, and probably kind of do it. But moreover than that, focus on yourself. This is your exam, and I am pretty sure all of you are really fantastic because many times you post content in the group and ask questions. Sometimes even I am confused what exactly is happening. So I need to go read back and we come back with that. It takes time sometimes, but I am really proud of you, all of you, that you are very well prepared, and I think it is going to go well. Okay. So, Vijay, anything from your side? And Vijay and Kiran?
Nothing specific, sir. I think you have entirely covered what is required for the next 4 weeks. And I think this is not only for the 4 weeks. This can be a strategy for whenever they want to prepare for any of the exams towards the last few weeks or days for the exam, even for the exit exam, when they are finishing the as well. So pretty much you have covered everything. Nothing to add on from my end. We will get back to these people again just a day prior to the exam as well.
Kiran?
So, everything Dr. Hemanth has covered, which are all really important. I would, I just add how I prepared. Probably it might help a few of you. See, whenever, let's say there are 4 weeks, I usually jot down all the topics which are need to be covered. So I'll take a paper and then write down the list of topics, not the exact things, but topics like supportive care, then the subtopics under it. And then I look at it, which are the most important high yielding areas. So like which Dr. Hemanth has put in a nice flow chart in the list. So all these topics, you dedicate a time. Like I'll spend 2 days for this topic, 3 days for this topic. So this is for revision, not to go and read something new. This for revision. And whenever you read something, you ask yourself, am I going to remember it after 2 days? Am I going to remember it after 1 week? Am I going to remember it after a month? Because 1 month is there for the exam. You revise Cairo Bishop criteria today and then you don't even revise at all till the exam. I think most of you will not remember the value of uric acid or calcium, right? So when you ask yourself, you will know, okay, you'll know the answer. You'll say that, okay, I won't be able to remember it after 1 week. I'll definitely have to look at it again. So keep a small book and list down, make a note of all those things which you are likely to forget after 1 week. And towards the end, like 2 3 days before the exam, you don't read any other new book. You just take that book where you have noted down all the things which you are likely to forget of beyond few days, and create mnemonics for all those things. This is where your friends will come into the picture. One or two of you, if you sit together and then try to create a very funny mnemonic about any of those things topics, you will be able to easily remember it. So do all these things for all the high yield topics. It is completely unacceptable if you don't know corona score. But then corona score or well score, all these things, what are the components of IPA, what are the components of Flippy? These are some things, unless you revise it, you'll not be able to remember it. So either you create a mnemonic for that, and like if you are likely to forget it, put it in a small book and revise 2 3 days before the exam. And then the concepts, if you have already understood the concepts, it's very unlikely that you'll forget. So if you have already understood the concepts well, you don't need to revise it again and again. So the 2 3 days before the exam, very important that you spend time on revising multiple times about all these things which you are likely to forget. And this is from my side. And second thing is practically, all of us, when I was preparing and I'm even preparing for the DM exam, when I start sitting, of 1 hour it goes well, and then 1.5 hours later I'll be scrolling something over the mobile. I think all of you will be preparing from your mobile or iPad will be next to you, and then you'll end up in opening Instagram and seeing. So my suggestion is to break that habit. Just put on the phone, do some 10 push-ups or 10 sit-ups, and then go for a walk. Come back 5 minutes later and start reading again. That is the only way you'll be able to break that habit. So every day, set a time. From after breakfast, I'll sit for 3 hours. In the 3 hours, I will divide it into each hour, and each hour I'm going to cover this aspect. So let's say I'm starting with vascular devices in oncology. Before starting the topic itself, I will decide I'm going to spend 20 minutes on revising this topic. I'll finish it. I'll take 5 minutes break. In that break, I might do some kind of exercise or take a small nap by closing my eyes, and then stop go on with the next topic. So once you finish, if you have a list of topics to be covered for that day, you finish off that and then strike it off. So they'll give instant feedback that by the afternoon, if you have covered like 5 topics, you have stricken it off, you'll feel very good, and then you'll have more motivation to read for the rest of the day. So create a list for the entire 4 weeks, and every day in the morning, create a list for that morning, create a list for that afternoon, and also decide how much time you are going to spend on revising, and keep a separate notebook for the points which are likely to forget, and exercise. And yeah, I think that's all. Rest everything has already been covered. Final thoughts, Dr. Heyman.
Yeah, nothing. I think be confident. You guys are really good. Definitely, from the time what I was, I know the exam can be probably sometimes stupid. Big, like how the what last NEET SS. I was really not happy looking at the paper on the way it was done. But you guys are good. You have that confidence in yourself. Focus, work. We are there with you. We'll try and support in whatever way we can. And I know at the end of the time, all of you are going to do well, and we always keep looking forward to kind of learn new things. Recently, it is now kind of 4 years that I've been a part of DocTutorials, and my first set of students have kind of really come out now. They've done their DM, they've finished and come out, and they've joined a consultant in different posts. Uh, I have somebody who has come back to Bangalore. Dr. Swastik, was my first student who had got into AIMS. He's come back to Bangalore, he's working with us. Uh, I have somebody who is doing really good work in ISMPO and Gurukul, if you see the student there. More importantly, I ended up learning from a student on how to probably manage a case. This is Dr. Antara. She is now in Bhubaneswar. She guided me. I had posted a case on how probably to go about, and she kind of really guided me on what best could be done. So it is a mutual learning, and that is what I'm going to see and hope for from here. So have the confidence in you. Make sure you're consistent, be thorough, be continuously revising, and whatever else, I think wherever we can, we will support you. Okay. So all the best. So I will again probably see you in the last week, and let's see how that goes. Okay. Good luck. I think we are going to close the session now. This is a short, quick session on probably how to go about. Okay. Thank you.